I'm Karen Lipshires, and I'm a registered nurse.
Karen works at a large teaching hospital in Boston. She is currently working on a medication safety project that uses computers to ensure the safe ordering of chemotherapy.
Hi, I'm Shirley Papp, and I'm a pediatric nurse practitioner.
Shirley has worked in neighborhood health centers, pediatric group practice, children's hospital, in schools as a nurse, as a volunteer nurse at a Girl Scout camp, and mentoring UMass nursing students.
Hi, I'm Linda Gilmore. I'm a registered nurse.
Linda works in the rehabilitation unit at a long-term care facility in Chelmsford. We've talked with nurses to find out how they got started in nursing and what a nursing career is like. All three nurses have many years' experience and much helpful information to share. What is especially attractive about nursing?
There's a lot of flexibility in nursing. So you could work nights and your husband works days, or your partner works days. And there's also, you can work long shifts. And now in nursing, you do 12-hour shifts, 3 12-hour shifts, and then you get the rest of the week off.
Nursing as a career has so many opportunities for people to do so many different things and work in so many different types of settings with so many different types of folks. What's important to us as a person changes over time. It's a career that allows us to find opportunities to do different types of work. So that what I'd love to do at 23, I can be doing that work, and if what I want to do at 33 is different, there are opportunities for me, and what I want to do at 45, there are opportunities there. So that's the kind of thing that I love about nursing as a profession.
It's exciting. I mean, there's a lot of opportunity, a lot of challenges. Every area is different. Every area has things that are hard and things that are fun and things that make you feel fulfilled.
You feel like your work is relevant and important. There is something to be said about, gee, I helped someone today, I might have helped someone today, but I really made myself feel better about who I am and what I'm doing.
Nursing at the bedside, when I think about the things that I loved most about it, I think it was the intimacy with people and being able to spend time with people, get to know who they are, what was important to them, and how their illness impacted that, and how we could temper that for them, and how they could learn to live with their illness.
Every day is different, so that's a challenge. Every day you're experiencing new things, and it's fun. It's fun, and it's a challenge, and it makes life interesting. So, just nursing is fun.
What I came to understand is that as a nurse, we're always teaching and we're always learning, but we're teaching other nurses. We're how to become better nurses. We teach new physicians as they come in about the hospital and about patients. We teach patients and their families how to live with their illness, or perhaps how to die from their illness. So I can honestly say that I don't think that there's a day that's gone by in all of my years of nursing where I haven't had a chance to teach something to someone.
It's just an amazing feeling when you've connected and you feel like you've brightened that person's day during that time, hard times.
I've been able to take care of people when they were hospitalized. I've been able to be at the bedside while people were dying and be with their families. I've been able to witness babies being born. I've worked in a job where I was able to help people who had illnesses that didn't keep them in the hospital, but that were challenging for them at home. I've been able to help them. I've been able to work on projects that help prevent medication errors and make sure the care is delivered safely. And I've been able, as I mentioned, to teach every single day I've been at work. And it's been much more satisfying than I could have imagined it would be. I had no expectations. When I got into nursing, I became a nurse because I needed to do something, and I needed to earn a salary, and I needed to have a job. And never in my wildest dreams could I have imagined how satisfied and how happy I would be with the path that I chose.
When did you decide to become a nurse?
I don't remember ever not wanting to be a nurse. From the time I was about 9 or 10, I always wanted to be a nurse.
I think I became interested in nursing as a career once I entered nursing school. I didn't always grow up knowing I wanted to be a nurse. I actually thought I wanted to be a teacher. It became clear to me that teachers weren't very much in demand. So I started to think of other things that I could do because I know I needed to go to school to learn how to do something and how to have a career and earn money and support myself. So I went to nursing school, and when I got accepted into nursing school, I said, well, maybe I'll be a nurse. I didn't know anybody that had been a nurse. I didn't really know what was involved with nursing, except that I figured you probably needed to know some science, and you got a chance to work with people.
I knew I wanted to be a nurse since I was a little girl.
What's it take to become a nurse?
I think it takes a caring person, a person who understands everybody is different, and in order to help them, you have to meet them where they are. You've got to be smart, you've got to be a problem solver, and you have to be always learning because medicine is always changing. There are new drugs out, there are new treatments out, there's new procedures out, and you've got to be aware of what's available and be able to incorporate it into your practice.
What does it take to be a nurse? It takes a number of different skills to be a nurse, and many of those skills get learned as you're being a nurse and get some experience. Some of those skills are time management, learning how to delegate to other people, learning how to look at a situation and seeing the big picture, and also being able to look at what you need to do right now. There are also tasks that you need to learn to be a nurse, and those tasks you actually really tend to learn more on the job, because the tasks are different depending on what area you work in, what types of patients you're taking care of. But the skills go across all different types of nursing. And it's one of the gifts of nursing is that there are so many different types of work that you can do as a nurse. The skills go with you no matter which type of setting you want to work in.
What education and training is needed?
My science courses were very useful in preparing. Courses such as biology and chemistry were helpful in preparing me for college to take courses that were more comprehensive or a deeper dive into those topics.
I went to Northeastern. It was a 5-year program, and they had co-ops. So we completed 4 years of academics in 5 years. So you'd work 3 months, go to school 3 months, work 3 months, go to school 3 months.
The program that I was in was a Bachelor of Science in Nursing, so I did 2 years of liberal arts and then 2 years of nursing school. You're taking courses in all the different fields in nursing: chemistry, math, English, anatomy, physiology, microbiology.
I had 3-hour labs. I had to take biology, I had to take chemistry, I had to take anatomy, I had to take physiology, I had to take all the sciences. And then, of course, then you have to take all the social sciences: psychology, sociology, anthropology, and also English and math.
And then there are the typical nursing classes. You're doing med-surg nursing, you're doing pediatric nursing, you're doing obstetrics, you're doing psychology. Today, a lot of nurses specialize and they key in on one aspect of nursing, but nursing school prepares you to do any of those.
Some of the other non-science courses and understanding the world and the people in the world, because those are the folks that we actually take care of.
I basically really enjoyed nursing school, and I enjoyed my instructors and felt that they were very supportive. Their key was to get everybody to understand and incorporate what they were teaching so that they would be better nurses when they graduated. Well, once you graduate from nursing school, you've got to take national boards. But it's nice because it's a national exam, and that means your nurse's license. You get licensed where you've gone to school and taken the exam, but your license is good all over the country. All you need to do is you move to another state and apply.
What skills does a nurse need to have?
Technical skills that are important. You know, this patient needs these tasks within this period of time, and every 10 minutes you do this, every 2 hours you do this, every hour you do this. So there's a lot of organization. You need really good organizational skills. Be organized and complete tasks, to have compassion, to have empathy, to care. I think you really have to like people, and that's all kinds of people. Not just nice people, but people who are sick and in pain and cranky. Help them get through their difficulties. And so I think you have to be a people person, because if you don't like people, you shouldn't be doing nursing.
How did you learn to use a hypodermic syringe?
We'd practice like on an orange, and then we had to practice on each other.
Going through the skin of an orange is very similar to going through a person's skin.
And we were instructed with a different angle that you're supposed to use and how to hold it.
When I was ready to give the shot on the floor for the first time, I don't know, I just did it. The nurse, the teacher was there, and this is your first shot to a patient.
And then one day you just actually have to go into a patient's room with a syringe and give your first injection.
And you just go 1, 2, 3, and you just do it, because that's what nurses do.
And injections don't hurt, or at least not for the nurse.
What you do may cause pain. How do you handle this?
Sometimes you walk in and you know that something painful is going to happen, but you're doing it not because you want to inflict pain. You're doing it because this procedure is going to eventually come to a positive conclusion, whether it's going to identify where the problem is, or whether it's going to relieve some of the problem through a painful procedure.
Explaining to the patient what's going to happen, how it's going to happen, why it needs to happen, and being skillful with the task you're doing all helps make it easier for both me and the patient during something that's liable to cause discomfort.
If it's just a shot, I just joke with the patient and tell them this isn't going to hurt me a bit. I go in, you tell the patient what you're going to do. If they've had the procedure done before, they already know it's going to be extremely painful. You tell them that you're sorry, that it has to be done. Typically they understand that. And you're as gentle as possible. If at all possible, you do a little bit of the treatment and let the patient rest until the pain subsides to a degree, and then do a little bit more, and you keep doing it until the treatment is over. Doing that kind of a treatment on somebody who's, they're in agony is just as hard on you in a different way, because it's emotionally hard on you to put them through that procedure as it is on them to live through it.
It's important, as nurses, we sort of have this list of things we need to do. The challenge is sometimes remembering that not only do we have our list of things to do, but there's a patient on the other side that has to experience those. And their experience has to be as important as our desire to finish the list.
What kinds of nurses are there?
LPNs are educated and trained to focus on the tasks that are required to take care of a patient. And it's a shorter training and schooling than what's required for a registered nurse. Registered nurses need an associate degree or a bachelor's degree in nursing before they can sit for their licensing exam. There's also nurse practitioners.
A nurse practitioner typically works with a doctor in a doctor's office and takes a lot of the stress off the doctor, can make rounds in the hospital, can order meds.
And nurse practitioners require yet even more education. And they focus not only on helping people adapt to illness, which is what a nurse's primary focus is, but they're also more involved in helping to decide what the medical diagnosis is and what type of medical treatments should be rendered.
A lot of nurses today specialize, so you'll have nurses that only do obstetrics, nurses that only do pediatrics, nurses who like to do orthopedics, emergency room nursing, in coronary care, intensive care.
You could be a nurse in a work setting, you could do employee health, you could be a travel nurse, you could be a nurse working on an Indian reservation, hospital nursing, camp nursing, school nursing, geriatric nursing, working in nursing homes, operating room nurses, recovery room nurses. Another thing is, when you live in a neighborhood, you could be the nurse for the neighborhood. So there's a lot of community service involved when you become the nurse of the neighborhood.
You can do one thing for many years and decide you want to try something else and go into another area.
What is a typical day like?
Well, there's no typical day. The only thing typical about a day as a nurse is you get there and you get report on your patients on what's happened for the previous shift or 2 shifts.
If a nurse is working at the bedside taking care of sick people in a hospital, usually when they come in, the first thing they do is they read through the charts of their patients and get a sense of their medical history, their allergies, what's going on for them medically. Are they getting better? Are they getting a little worse? And then they will sit down and listen either on tape or directly face-to-face with the nurse that was caring for them right on the previous shift, and they learn how the patient's doing right now.
They do try to keep your assignment the same, so you have the same patient or patients for the duration of their stay at the hospital.
The next thing you do is kind of sit down and think about, what does the patient need done, and how am I going to organize my time to do that?
This is very task-oriented. You know, this patient needs these tasks within this period of time, and every 10 minutes you do this, every 2 hours you do this, every hour you do this. So there's a lot of organization. You need really good organizational skills.
Well, now I have 5 of those folks, so how am I going to organize all of those things for all of those patients to make sure that things get done the way they need to be, and the patient gets what they need by the end of the day when I go home?
The things that you've got to do is typically you've got medications to pass out. Patients sometimes have tests that they need to be prepared for, or you need to make sure that they're transported on time to a particular part of the hospital or the facility for x-rays or treatments or whatever. That's what makes nursing so much fun, because you don't know what's going to happen from one day to the next.
What challenges do you face as a nurse?
There are always challenges. You never know what's going to happen that day. Language barriers, religious needs of a particular patient, dietary constraints.
There are interruptions all day, every day. The interruptions can be important interruptions. You're working with one patient and somebody else needs something. It's time for them to go to a test, so that you had a vision of what you were going to do and when you were going to do it, but they need to be somewhere else. The family member calling and wanting to know how they're doing. The physicians have come up to the floor and they want to hear what you have to say about the patient. Mandatory documentation that has to happen to show that the work's gotten done. Not only you have a plan for how you want to care for the patient, but what you did to help follow that plan and whether or not the plan worked. And all of that has to be written down somehow. There are medications that you want to give your medication to the patient, and it's not handy and readily available because it's a new medication and the pharmacy hasn't sent it yet. Somebody else needs help. Perhaps their patient's gotten very sick and they need you to help keep an eye on the rest of their patients. So the day is full of challenges in being able to know where you want to go and actually getting to that place. You can be called away 5, 6, 7 times on one trip down the hallway.
Every day is a challenge. Every day is a day when you've got to do problem solving. Every day is a day when you've got to meet all of your patients where they are, and that can be a challenge, especially if you're very busy. But even if you're not, meeting everybody where they are and with what they need that day is a challenge.
What advice do you have for those considering nursing?
Nursing school can be tough. There are days when you're working and you think, why did I do this? But by and large, it's such a rewarding profession.
Actually, it can be lucrative, as far not as making $1 million, but it could put the bread on the table, because nurses are fairly well paid now.
You get to help people. You get to touch a lot of lives. You're a positive influence no matter what area of nursing you go into. You can be a positive influence on your patients, your coworkers, families of patients. It's very, very rewarding, and it's a feel-good profession. Even when your day doesn't go right, you can still feel good about how you did that day. I've touched a lot of lives, even if I don't remember their names and they didn't remember mine. I've touched a lot of lives in a positive way, and that makes me feel good.
If someone told me they wanted to be a nurse, I would first congratulate them on a great decision. I would also suggest that they be prepared for some rigorous schooling. And I would suggest that they grab a backpack and fill it with compassion and enthusiasm and a willingness to advocate for other people, and congratulate them on being willing to step in a profession that's committed to helping people at their best and at their hardest, during their hardest times.
So we're ready for you.
All three are recording?
Is it on now?
Yeah, it's on.
Oh gosh. Okay, I gotta be nice. All right, go ahead.
Sorry?
I sense you at the end of the answer.
I may want to answer it again, I don't know.